I'm delighted to introduce our first speaker for the day to get things started, Dr. Jen Gommerman. She's going to talk to us about the immunology of how the COVID vaccines work. Dr. Jen Gommerman received her PhD in immunology at the University of Toronto and did a postdoctoral fellowship at Harvard Medical School just before joining Biogen Inc. as a staff scientist in 2000. After 3 years in industry, she returned to the University of Toronto, where she's since been promoted to full professor and last year awarded a Tier 1 Canada Research Chair in Tissue-Specific Immunity. Jen's basic research focuses on autoimmunity, particularly the disease multiple sclerosis. More recently, she's been studying the antibody response to SARS-CoV-2 in patients with COVID-19. Remember, we'll have an audience Q&A after all three presentations, so get those questions rolling in the chat. I know we're all excited to learn from the wonderful Jen Gommerman, so over to you.
Thanks so much, Sam, and bonjour à tout le monde. Good afternoon, everyone, and it's great to be here and to talk to you about some really good news. So my job today is to teach you a little bit about the immune response to SARS-CoV-2, the virus, and then what happens to your immune system when you're vaccinated to protect you from developing COVID-19. So you're probably pretty familiar with this diagram right now. This is the SARS-CoV-2 virus in simple format, and it's composed of a number of proteins that make up the structure of this virus. And the protein that you have to think about for this presentation is called spike. This is the protein that is important for entry of this virus into our human cells within our airways and our lungs. And because of that, it's really an ideal target for current vaccine strategies. And it's called spike because that's exactly what it looks like sticking out on the surface of this virus. And unfortunately, this virus has, as Sam has already mentioned, has wreaked havoc across our planet. Approximately 126 million infections to date. That's likely an underestimate, and greater than 2.7 million deaths at this date. So what we learned fairly early on in the pandemic was that the major mechanism for spread of this virus was through droplets. Yes, you can get it from contacts with surfaces, but really it's aerosols and droplets that come out of the airways that are really causing this spread of the virus. And so what happens is if you are infected, in the first stage of the infection, you usually don't feel anything. And because you're asymptomatic, you may not know that you're actually spreading the virus, and you're spreading it by speaking and breathing, especially yelling, etc., and sneezing. And that's why this virus has been such a big problem, because it's so contagious, and it's contagious at a point in time when we don't know we have it. And that's why we've had to exercise many public health measures, for example, physical distancing and masking. So what happens when you get this infection? Well, hopefully you won't get this infection, but what happens is that there are these cells that line your airways called epithelial cells. And the virus stick to these cells through this ACE2 receptor. And it will go inside the cells, it will infect the cells, and the cells know immediately that something is wrong, and they'll start producing something called interferons. And these interferons are part of what we call the innate immune system. This is a sort of an alarm signal to send out signals to the rest of the immune system that something is going on and it's not good. And this is triggered by binding of the virus to the surface of these epithelial cells. And these cytokines and interferons are released and bring in other immune cells. Now, it takes a while, maybe about 7 to 10 days, but eventually the adaptive immune system kicks in and gets to work to get rid of this virus. And the adaptive immune system is composed of both T cells and B cells. T cells are the cells that can actually directly kill an infected host airway cell. So here's a host airway cell that's infected with the virus, and this T cell knows that this particular airway cell is infected, not this one, but the one in the middle. And so what it does is it actually directly kills that cell dead, and that's a way of bringing the viral load under control. The other thing that happens in the adaptive immune response are that B cells, which make these antibody molecules that you've heard about quite a bit, because we use them to measure whether a person has been infected with the virus in the past or not. These antibodies will stick to different parts of the virus, particularly that spike protein, but other proteins as well. And by doing that, it can prevent some of the antibodies, especially so-called neutralizing antibodies, which you've also probably heard about, will prevent that virus from sticking to the host cell and entering into the cell. So that stops the virus in its tracks. Now, one of the canonical concepts about immunity is that we have the capacity to remember prior infections. So if you're infected with a virus like SARS-CoV-2, that virus is going to initially infect your airways, and then it will take some time, but then it will build up to a level that peaks. And this initial exposure is then brought under control at around the same time that your adaptive immune system starts to build up. So again, these are your B cells and T cells. And this is what brings the viral load down back to zero. And at this point, you've cleared the infection. Now, let's say a few months go by and unfortunately you're exposed to the virus again. Your immune system will remember the initial encounter, and it will make that immune response, but it will make it at more briskly, and it will make it to a greater degree than what you had during the primary immune response. And so you're going to quickly neutralize that virus and get rid of the virus. And you might not even know that you were infected with a second dose of the virus. And that's because your body's making more antibodies, more B cells, and more T cells, and it's remembering that previous infection. And it's this concept of immunological memory that really underpins vaccination. So what is a vaccination? Well, vaccinations have been attributed to many, many saved lives. We know, of course, that vaccines work against many childhood diseases that used to be extremely damaging to children or could even kill children, such as polio. And these vaccines are typically parts of a virus, an inactivated version of the virus that you give to a person, and it tricks your immune system into thinking that you actually have an infection, but you don't. You're just being given an inactivated part of the virus or a part of the virus. And the same immune response takes place as what I just described, but there's no replicating virus in your body. So you don't actually get sick from the virus. And this also teaches your immune system to make a memory response so that if you do confront the real virus in the wild, you will be protected. Now, as soon as the pandemic began about a year ago, really international efforts were launched almost immediately to develop SARS-CoV-2 vaccines. And this has been one major arrow in our quiver of arrows to fight this war against COVID-19. And I just updated this today. This has been changing pretty rapidly, but if you're interested, you can go to the New York Times Coronavirus Vaccine Tracker, and it will tell you how many vaccines are in all these different phases of approval. And the next speaker, Dr. Sharma, will explain more about what these phases do. So how do these vaccines work? So these vaccines are basically, I'm going to just show you here the mRNA vaccines, which were really the first to hit the communities and were the first to be approved by Health Canada. What happens is that in the case of an mRNA vaccine, you get an intramuscular injection in your arm, and then the vaccine contains basically a little bit of that spike protein. So it contains what's called the RNA that encodes for that spike protein. And it also contains some fats, some lipids that allow for that RNA to be really stable for a period of time and also allow it to be taken up by the cells in your arm. And so that's exactly what happens. The mRNA gets inside of your muscle cells, your myocytes, and it's transcribed and makes those spike proteins. And those spike proteins are then displayed on the surface of that myocyte so that the immune system can learn from this. And so the immune system sees these spike proteins as foreign. It thinks that there's an infection going on when really there isn't. There's just some of this mRNA. Now, I should mention that this mRNA doesn't hang around forever. It will eventually get degraded. And there's no live vaccine. There's no live virus in this type of injection. It's just RNA. And then once this spike is displayed, it kicks off that same kind of immune response that I told you before. So we'll activate the B cells. They'll become what are called plasma cells that really churn out tons and tons of antibodies and can live in our bodies for even decades, depending on the type of plasma cell. So this gives you long-lived immunity. And then also those T cells are generated by vaccination. And as I mentioned, the cytotoxic T cells can actually kill infected epithelial cells that have the virus inside of them. So together, this provides us with not just one type of immunity, but pretty multifaceted immunity that can deal with the virus if you encounter it in the wild. And as you know, there are some vaccines that have already been approved by Health Canada. And these are just shown here, and you've probably heard about them in the news.